it's Roxana Moran, Professor of Medicine at Division of Cardiology here at the Mount Sinai Fuster Heart Hospital. I am so thrilled that I have my guest here today, Dr. Deepak Bhatt, Professor Deepak Bhatt, who is the director of the Mount Sinai Fuster Heart Hospital here at Mount Sinai Fuster Heart Hospital, and the Icahn School of Medicine at Mount Sinai. Welcome.
Great to be with you, always.
It's so good to have a little chat with you about Heart Center in Women. As you know, here at Mount Sinai, at the Mount Sinai Fuster Heart Hospital, we have put together a center for Heart and Vascular Center for Women. Do you think that's important, or is that an outreach to say we have to have a center just for women?
I think it's incredibly important given the history of cardiovascular medicine, the historical undertreatment of women with heart disease, the under-identification and then undertreatment of women with heart disease. Certainly there's been progress made over the past couple of decades. Indeed, you've led a lot of that progress. And I think we should collectively as a cardiovascular community be happy, but not rest on laurels and realize there's more work to do. I think that's true in clinical care. I think that's also true in the research world.
We've been really lucky with your leadership here and how supportive you've been on this. And a lot of it has been based on the fact that you believe that a multidisciplinary approach is the way to go for treating women with heart disease, and that we should use all opportunities we have in terms of identifying cardiovascular disease. You want to comment a little bit more about that?
Absolutely. There are really a couple of approaches to identifying disease in general and women specifically. One can just be whatever patient happens to show up in the office. That's not bad. That's how most of medicine's practiced, but it's not ideal. A lot of patients fall through the cracks. A lot of women will fall through the cracks with that method. I think it's important to take a multidisciplinary approach and realize that women are cared for by multiple different specialties, OB-GYN, for example, and as I had written in an editorial some years ago, pregnancy is a cardiac stress test. That is, when women have various complications of pregnancy, that is often a sign of latent cardiovascular disease. It's not just, oh, she's pregnant, the diabetes is just gestational, don't worry about it, or the hypertension she has just a consequence of pregnancy. No, in fact, it's a cardiometabolic stressor. And when those risk factors emerge, even if they disappear shortly after pregnancy, it's important to realize those risk factors will once again manifest later on in life. You'd written about this some years ago too, how pregnancy could be a risk factor for all sorts of bad cardiovascular outcomes later on in life, complications of pregnancy. And I think at this point in time, you were ahead of the curve back then, but I think at this point in time, there's enough data to support that. So in women where there have been problems identified during their pregnancy, cardiovascular complications, really ought to put that woman in a preventive cardiology program right then and there.
No, I think that's such a great example because that's finding women at their peak of their life in the most important time of their life. But you've also been a champion in cardio-oncology. You want to talk a little bit about that, especially with regard to women?
Absolutely. Cardio-oncology is exploding across the country, around the world, because there's a lot of heart disease, there's a lot of cancer. People are surviving longer with both, in part thanks to effective screening and treatment methods. But a challenge then is in that patient who has cancer, well, the fact that they're living longer is great, but that exposes them to cardiovascular risk. In fact, a lot of cardiac and oncologic diseases share risk factors, smoking sort of the obvious ones, but even risk factors like obesity seem to be common for both disease states. So really in the woman where cancer has been identified, most often we think of breast cancer just given its high prevalence. It's important to screen for heart disease. It's important to treat heart disease early. It's important to realize that certain chemotherapeutic regimens increase the risk for heart disease. So I think as an example, a woman with breast cancer really needs a multidisciplinary approach, and part of that includes screening for heart disease. And when risk factors are identified, or indeed existent heart disease is identified, very important to be referred for cardiology care. And I think that's another great example of where a women's heart center, such as the one you lead here, can do such a great job bringing together folks from OB-GYN, bringing together folks from oncology, ultimately to improve the care of women.
Well, this has been incredible conversation with you, Dr. Bhatt. Thank you for your leadership and for support of heart disease in women. Heart disease is the #1 killer of women across the globe. and especially right here in our backyards. So we need to really pay a lot of attention. So when you see a woman, make sure you ask about their pregnancy-related complications. Make sure you screen for heart disease, valvular, and cardiovascular. And make sure that you evaluate their peripheral vasculature as well. So very important. And much more important is all of their metabolic risk factors. So you just heard Dr. Bhatt, and these fields of cardio-obstetrics and cardio-oncology are on the rise because we're bringing all the disciplines together to fight heart disease in women. Thank you so much for listening, and come back to us. We've got more.
Thank you.